On the second of these videos, looking at George, the wound care model, I want to look at this area of damage here on the right side of the model. This is up on the right hip at the head of the trochanter, and this area we can see initially looks like a large dark black-brown area of dry, hard eschar or dead skin that's of no value at all to the wound. It needs to debride, it needs to lift away, and when we do that we see the extent of the damage underneath. So this is pressure damage again and again over the very large bony prominence that there is underneath, and caused by the starved tissues losing their blood supply and breaking down. You can see I've taken the eschar away, and underneath it, this is very typical of the type of damage you might see in this area. Again, a large, fairly circular area of skin loss, and in the centre here, just to the edges here, we've got brownish dead tissue. It's starting to lift away, it's separating from the wound bed by the process of autolysis, where the body's own enzymes are helping separate the dead tissue from the healthy. And if given time and the right circumstances, that will happen quite successfully, leaving the rest of the wound bed, we hope, clean and healthy to heal. So remove the pressure, remove the shear, make sure your patient's fed well, make sure they're properly hydrated, improve the blood supply where possible, and take away all the other contributory factors that are important for skin health, such as having proper levels of haemoglobin, stopping smoking, eating the right kind of balanced diet. All of those things will help promote the healing, and importantly apply the right kind of dressings to lift this area here to leave a nice healthy wound bed. And we can just see on this, if we look underneath these edges here, this is undermining, so there is some shelving here. We can tuck your finger here. Obviously on a real patient you'd have gloved hands and use a sterile probe or sterile gloves just to very gently lift the edges and check how far down that wound extends. So what we see on the outside with this wound isn't the full extent of damage. There is more underneath at the edges. You need to be aware of that when you measure the size of the wound and when you describe the amount of damage. And again here on the edges you can also just see some red bruising to the skin. Again, makes us concerned about whether exudate is sitting on the skin and damaging it, and again whether there are other pressures there on the skin, and that redness perhaps is showing us again the early stages of skin damage as the microcirculation has been affected.